Hello, everyone. So as an intern in dietetics, I thought that it was hard to gather my thoughts about an education that I was about to give, how I was going to enter the room, carry the conversation, and exit in a not weird way. I don't know, I'm just someone who tends to overthink things, so I just kind of wanted to come in there and seem like I know what I'm talking about. You have all this education, all that time into studying, and you want to build rapport with the patient and connect with them. So when I was looking on YouTube, I could find some good education sessions, but I couldn't really find anything that was dietetic or dietitian centered. So I thought, maybe I'll start the ball rolling. This is literally the second YouTube video that I've ever tried to make, so if it's a train wreck, at least the ball is rolling, and, if you can think you can do it better than I can, perfect, because that is, exactly what I want. I want people to start, at least, like, putting themselves out there, and it's going to be a rumbling, tumbling mess because I kind of tend to ramble. I edit as best I can, but I'm just going to try and do my best to show what I would do during a nutrition education session. So first of all, I tried working from home right now, but I, put some effort into your appearance, use accessories that make you feel confident. I'm someone that loves to accessorize with glasses and a simple chain. So whatever makes you feel cute. I know that some people, you're going to be writing down what the patient tells you. So I personally like to keep a pen attached to, if I had my badge here, I would attach my pen to, the extendy bit on that. And so you always have a pen with you. And I think that's just something, just kind of feel like you're put together. I also have a simple clipboard. I know you can buy them at Target, Walmart, wherever, where they have like, a part where it opens here, and then you can put some different things in there. Like if the patient wants a snack list or something, I know that, practicing dietitians and interns use that. A standard clipboard is what I used for when I was working at food service and I was rounding and taking patients' orders and talking to them. So that's just what I use right now. So on my clipboard, I have snack lists. I have something that I created myself. It's just a little script just because, you want to hit everything when you're in with the patient, but also if they kind of go off task, you can be like, okay, where was I? And kind of keep it streamlined a little bit, because sometimes, especially the older population, they like to either chat you up or just someone who is chatty, and you find yourself, you want to build that rapport, but it's a balance between talking to them and making them feel comfortable, but also doing your job and trying to get the information that you need. So I have this script. I've got some, shake lists that are from the internship themselves. I just put them in here. So these are my copies. So I know that I always have some with me if they're in this little sheet here. And then I also have some at the bottom that I could hand to the patient. And then I have some more snack menus. They have a lot at this internship, which is great. A lot of variety. And then I also have the formulary, which is, this is the enteral nutrition formulary. On one side, it has just the formulas, and then on the back side, it has supplements that you can add, like the protein additives, fat, whatever. And I think this has always been helpful because, you got this when you go into your room, but when you come back to chart, then you also have this with you. So I always found that kind of helpful. And then, so there's these things that you can buy. I think I bought it at Target or something. I freaking love Target. And you can laminate things. And this is pressure incident treatment. It's a flow sheet that I covered with more script. So, and then on mine, I just have, you can put sticky notes on the backside of your badge, or you can have sticky notes on the bottom of your, clipboard? So, and then I also have segmented weights for limbs. So if someone, you had extreme cancer and they needed to remove some part of their arm, some part of their leg, what have you, then you always have that information for an adjusted body weight. And then I have an assessment cheat sheet, but you know what? Every dietitian is different. So sometimes I just take notes on that and just kind of go with what they say. And, it's an accumulation of all the things that all the dietitians have to teach you, and you just take notes and just kind of roll with the punches. So you've got your life together here. You're about to enter a patient room. You've got your script here. At least I do, because that's what I like. So when you enter the patient room, obviously you want to knock, identify yourself, say, hi, I'm the dietetic intern. My name is so-and-so. And if you're here with another student or a preceptor, always introduce them. I know that patients like to hear their names, or you could say, I'm here with another student and the preceptor. If you get nervous, I've definitely accidentally done that a few times. So it's okay to kind of look down at your script, but you definitely don't want to use it as a crutch. It's definitely a guide, because you want the conversation to flow naturally. And you can also have, your bariatric education, your whatever education that you're about to give, low fiber, whatever it is, and have it here. And you can also have your personal notes on that. So okay, I need to touch on that. I need to really emphasize that. And so you can translate that to your patient education. And so I always like to start with, how are you feeling? It's a pretty good segue, I feel. People like to talk about themselves, especially if they're not feeling well. And then you can gauge about how much education that you may or may not be able to give that day, if they're feeling bad, if they're still waking up from their anesthesia, or if they're feeling great, then you could probably roll with it. If there's someone else in the room, like a doctor, obviously wait, but if it is significant other, if it's their parent, if it's a child or friend or whoever is visiting, if they can during these COVID times, you always want to acknowledge them. I like to say, it's great to have another pair of ears to hear this information, so that you can take this home with you and, have someone to help you remember all the points that we talk about today. And you could say something like, if this is a bariatric surgery patient that was on the table for 10 hours yesterday, you can acknowledge that and say, hey, I know that you just had surgery. So I know that things take a little time to recover from that. You're newly anastomosed, or, the things that they plug the tubes together, that takes time to heal, and your stomach and your whole GI tract is going to be as small as it will be until it heals. And you could give them any updates. I like to just kind of throw it in, hey, we advanced your diet to whatever. If it was dysphagia, now it's, liberalized or whatever, just so they know, because sometimes in the hustle and bustle of the hospital life, patients may not be updated exactly when it happens. You may be the first person to tell them, hey, you were on a 2-gram sodium diet, and now you're on a regular because you haven't been eating very well. And we wanted to liberalize that for you. And you can kind of talk about things like, okay, we want you to focus on getting your protein first. And, you can just kind of lean into it like that. And maybe if you feel it's appropriate, you can say, once you're eating better, we may put those restrictions back on. Just kind of depends on their situation. If this is an initial, you want to talk about, hey, I saw in your chart that you may follow a blank diet at home. And if it's not in their chart and this is brand spanking new patient, you could say, hey, so what kind of diet do you follow at home? You can kind of follow a pattern of a little introduction, and then how are you doing before you came here? And then how are you doing now? And then if you want to, at the end, you could say, okay, we are going to think about doing this in the future, if you feel it's appropriate. So on mine, I have, kind of typical, it's kind of hard to see because it's kind of shiny, but so I'm right here on my sheet here, and you can just kind of talk about like generally, you just want like a general situation here. I do know some interns that say they had oatmeal for breakfast, and they're really specific, but you just kind of want a general vibe of how they're doing. If they say they eat a high fiber diet at home, you kind of want to ask them, okay, how many fruits and vegetables do you eat per, like maybe how many servings do you eat per meal? And then you can gauge, okay, do they actually have a high fiber diet at home? That may impact the tube feeding that you give them, or, different things like that. So sorry, I haven't had surgery rotation in a while. Like I said, I've been working from home. I always want to talk about their appetite. If they feel like they are having any pain after eating. And if this is a bariatric education or something like that, you can say, you definitely want to like slow down if you have any pain. You definitely want to take things slow, listen to your body. This may be the first time that a patient has ever felt full after bariatric surgery. So, you want them to you want them to just kind of like adjust and get used to their new body anatomy. Their stomach may be the size of an egg or a small banana, depending on the bariatric surgery they got. So this is going to take some time to get used to. So definitely want to address any weight changes. You're more likely going to be charting on that as well. If they were stating that they did have any weight changes, you want to say, okay, how much weight do you think you've lost? And then ask them when they were that weight. And then you can go into the chart and double check. And if there is a difference, you can say, this isn't patient reported X weight since, blah, blah, blah. And this is or is not consistent with what the chart says. If they have a lot of admissions, you can definitely cross-check that, depending on the hospital you work at. So, and then you can kind of go into how the patient is now, and I like to kind of start with have you had a chance to eat or drink anything while you've been in the hospital? I really want to check to see if they're NPO before you ask this question, but at this point, usually patients will say they either love or hate the hospital food. Sometimes you can do something about that and sometimes not. If they had bariatric surgery, definitely want to see what kind of fluids that they're drinking, or if they're taking things slowly. You definitely want to talk about those kind of things. And then you can lead into the bariatric surgery education at this point if you feel like you want to. I know some other people want to kind of address that right away, kind of like, how are you feeling? I'm here to talk to you about the bariatric education. Do you have any questions right away? And then just kind of rolling into it. So definitely no hard and fast rules about how to do this education. I'm just kind of giving you some guidelines. So, and then how is their appetite at the hospital? And if this was different before they were admitted or not. And if they're tolerating their tube feeding, or you can just skip that if they don't have any tube feeding. Some of the newer things they're doing right now is NFBEs. So if you feel that they are a patient that meets the guidelines for malnutrition, you can do an NFBE. There's some great videos on NFBEs online. I'm sure that you've had them during your undergrad or maybe grad school or maybe not, but I think it is definitely good to keep the conversation going when you are doing it. It kind of seems silly when you're doing it on your friends and they know what you're doing and they know why you're doing it. And it's definitely not that you, okay, so when I first started, I was asking for their consent at like every part. And I think that, you know, like, oh, can I open this, like, snaps to see your shoulder? Or, you know, is it okay if I touch your face? And I think just, you know, patients are more used to, it's not that you don't want to get their consent, but patients are more used to the hospital setting at this point, and they're used to doctors coming in and out, and they know that you're there to help them. So I think it's more kind of inferred. I just kind of ask now that when I do my NFPs, excuse me, I just kind of ask like consent one time and then just kind of like roll with the whole NFPE. And I start top bottom, or start from top to bottom, and just kind of like talk to the patient about like what I'm finding. But you want to do this in a nice way. So, one of my preceptors was looking at someone's collarbone, and he did have some malnutrition. He did lose some weight, and she was like, oh yeah, you can really feel that ketchup packet action here. Well, she didn't say it quite like that, but she was referring to his muscles as, and like comparing it to a ketchup packet, which I looked at that poor man's face, and he looked kind of defeated. So you definitely want to think about what you say, even though you know like what you're looking for, and maybe not like communicate it in that way. You can just more say, oh, okay, so I do feel your bone here a little bit, kind of things. And you could say, oh, your legs look a little smaller here. Do you feel like you've seen some weight loss in your legs? From personal experience, which is very limited to this internship, I feel like a lot of people have lost more weight on the top part of their body versus their legs being more conserved with muscle and fat. And then you can also say things that are, you know, like somewhat related, but not like pertaining to their body. Like, do you feel like your clothes have been fitting looser lately? Things like that. So you can kind of keep the conversation going and gather information, and you can throw this all in your chart. This is great information to have. And then some people joke about that we're pretty much like a supplement distributor, but if you know, it's very important to have the supplements if people just aren't eating, if their appetite is low. Obviously, we want them to eat whole foods first and then go to supplements, but you can gauge, I think, pretty well if they have been trying to eat, or, you know, like the portions seem too big or something like that, and then you can just kind of throw some supplement options at them. I like to highlight certain ones that are, you know, like you always want to be conscious, like, do they have diabetes? Okay, now what should I recommend to them? Or if they have dysphagia, like nectar thick, which options? Okay, maybe I'll do this one instead of that one. You know, you kind of have to think about your population, obviously. But also, I feel like there are some blanket recommendations that you can make. You could say, oh, I always recommend this one because it's 30 grams of protein and it's only 120 calories or whatever. And so you can kind of roll with that. Or if they do drink nutrition supplements at home, obviously you want to kind of honor that. Especially, you want to do what the patient will eat and drink. So if, you know, that is the one that they prefer, go for it. You can always make suggestions. And then for exiting, if they had some surgery on their pancreas or something, like a Whipple, or I don't know what kind of stuff you guys are going to be introduced to during your rotation, but you can always emphasize like certain things at the end. So if they had like a Whipple surgery, you could say, please remember to eat small frequent meals. Make sure that you are eating very slowly. You want to listen to your body. You want to maybe try drinking outside of your meal intake. just so you make sure that you're getting in the calories during your meals. And then you want to make sure that you are sticking to a low fiber diet a week or two outside your surgery, after surgery, excuse me. And then you could slowly add those back into your diet. And then when you've got your info, you can kind of like transition to, okay, I'm going to leave now. So you can say, do you know when you'll be discharged? Sometimes that's true, and sometimes it's, sometimes they can just tank, especially after having surgery on their pancreas, like Whipple's. Sometimes they can just like be doing great for 2 days and then be doing absolutely crap, and they need a drain, and they need, all this different stuff because their pancreatic juices is spilling into their abdominal cavity. So it's just, sometimes they'll tell you something and the nurses will confirm that, and then 5 days later they're still here. So just kind of more of a conversational thing. And then kind of like, anytime someone says they're going to discharge, it's more of like kind of keeping in your head like, okay, that's probably a soft discharge date until they are having discharge papers into their chart note. Just something I've noticed. It could be different at your hospital. And then you can talk about like tube feeding stuff, like if they're going home on tube feeding, has the nurse talked to them about flushing or, different things, and do they have all the parts of their tube when they, before they are discharged, different kind of things like that. So you can kind of hold on to that conversation, and I like to, incorporate something that they've said while, into my exit statement. So if they say, at the beginning, oh, I'm doing crappy, you could be like, well, I hope that you, as the day goes on, you feel better, or maybe tomorrow, you feel a little bit stronger, what have you, feel a little bit more healed tomorrow, whatever. And I always kind of include that, we will be following along with you during your hospital stay. And you could just kind of say like, thank you for listening, whatever, or you could just kind of say that as you're walking out. Exits are not my strong suit, but just kind of go like that. Obviously, if they have different, it just depends on the education that you're going to give, and when you want to insert that into the conversation. I know there's some people that really want you to, or not really want you, but there's some dietitians that prefer you do the education right away, ask if they have any questions. And then there's other dietitians that have told me to do the initial and then do the education at the end because, educations are different. A bariatric education will take relatively your whole time there. And it also depends. And then some other educations like, someone just had like a J pouch put in, or, something like that. And your education's just going to be a little bit shorter, just kind of a low fiber, or if they had a liver transplant, food safety is going to take up a long time. So you just kind of want to keep in mind how long your educations will take, and make sure that you are honoring what your preceptor wants you to do. Obviously, if you are being a staff relief, this is, you're running the show. So, however, if you feel like you've done, like how you feel like you want to incorporate all these different nuggets of information into your own practice, that's obviously like up to you. So, thanks for listening. Sorry in advance for my awful editing skills and rambling, but I hope that you found this helpful, and hopefully we can get the ball rolling for some other better nutrition education sessions, examples, and just keep in mind that I am an intern and not a practicing RD, so definitely listen to your preceptors on what to do and what they want you and how they want you to fill out those educations. So thanks for listening. Bye.